More than 80,000 people in the capital are living with dementia, but the number of care homes to look after them is falling. There are 500 fewer homes now than there were 10 years ago. All this on top of cuts to support services for people with dementia. With this special report, here's Alpa Patel.
Elizabeth Bond on her wedding day. She was a teacher, is a grandmother, but in her 80s, Alzheimer's set in.
Good morning, Mummy. How are you this morning?
Today, Elizabeth, now 93, is looked after here at St Anne's nursing home, run by nuns. She gets NHS funding towards the cost of her care, but her daughter Catherine and her family say they had to fight to find her a place.
There are very few care homes in the London Borough of Hackney. They were saying, well, we can find you a care home in Chingford or Enfield. We were saying, or Pimlico. We were saying, no, that's not suitable. We've got to find something local. Because when someone is this old and frail and ill, you don't want to be moving them around all the time, because it's not only is it physically a huge haul and strain, it's also mentally a major issue for someone who's confused with Alzheimer's.
During the search, Elizabeth got pneumonia and had to spend time in hospital. She recovered quickly, but with no care home for her to move into, she spent 7 months in hospital.
Then she got into a situation where she was bed blocking. She was in the elderly care unit, and there were other women who were clearly in the same position as her. I used to go and visit her, and it was like she had this little group of ladies who just stuck there.
There is a serious concern about the availability of care homes across London, and that's because around 500 have closed in the last decade, this one included. And the situation is particularly stark here in Haringey, which has lost the most number of nursing home beds in the whole country. This is what happened between 2013 and 2015. Green shows the boroughs where the numbers of places are increasing. Pink and red where they are falling. But look at how that changes in just 16 months. More boroughs turn pink, the most extreme drop in Haringey, which has lost 23 care homes in the past 8 years.
We know that the context is that there is less money in the system and providers are receiving less money for the care that they're providing, and adult social care is being squeezed. And I think it's almost reaching crisis point in terms of the lack of funding.
There are particular factors in London which make it difficult to run care homes. The price of land, the price of housing, and secondly, recruit staff to care homes in London.
Catherine and her family recognise her mum is one of the lucky ones.
Whatever happens in the future, I know that she's been really well looked after. I don't have to worry about her. Now we've got somebody who is happy to be alive.
But for so many others, the battle to find a place is just getting harder. Alpa Patel, BBC London News.
Well, we did ask the government for an interview, but they declined. They did send a statement, though, saying that they have introduced new laws to make sure that no one is left without care if their care home provider closes because of insolvency. Well, we can speak now to the former Care Minister, Liberal Democrat Paul Burstow, who was the Care Minister during the coalition government. Welcome to the programme. We heard there that services for people with dementia are on the brink of crisis. Is that how you would describe it?
I think we've been approaching this brink for so long that I think we should stop using the word brink. I think we're at crisis point. You can see that in your package, the numbers of people who are now caught up in hospital beds waiting to be discharged. They're fit to go. They're ready to go home or to go into a care home, and those places aren't available. So there is a crisis here, and the government, successive governments, have failed to tackle it.
And of course, those people in beds waiting to be discharged mean that the beds can't be given to the people who really need them. This is placing an incredible strain on an already stretched NHS.
Absolutely, it's a double whammy, and it's a monumental false economy, not providing the resources to help get people out of hospital to where they want to be. They don't want to be in hospital anymore once they're well enough to go home. And that does jam up hospitals, and we'll see that really played out even more across London during the winter.
Whilst you were Care Minister, you were responsible for bringing in legislation which entitled people to have a care home near where they live. The problem is that the care homes are disappearing. What use is that law if there are no care homes?
To be honest, it's no use at all. It's no use at all unless it's backed with additional resources. It's one of the things that I argued with the Treasury as a minister. We didn't win that argument with the Treasury, and it doesn't seem that the current government's got the message either, because the autumn statement said nothing about this.
But if we're in a crisis, as you say, why is it so difficult to persuade the Treasury to give the necessary funding for this huge problem?
I think the truth is that they see this as being an extra cost with no benefit. They don't recognise the fact that it's families who wind up shouldering the extra consequences. And
even though, as you point out, it's also a false economy because of the strain on NHS resources, for example.
I think that's the case. I think that the Treasury is particularly tough and hard-hearted on these issues and doesn't face up to the fact that we have an underfunded social care system.
Well, Paul Bastow, we do appreciate you coming in. Thanks very much for talking to us. And for further support on dementia, you can call the National Dementia Helpline on 0300 222 1122.